Hey, I'm Caroline. I'll be your student nurse today. Today I'm going to be doing your head-to-toe assessment. And so before we begin, I would note that the patient is sitting erect with arms in her lap and that she appears well-groomed and well-nourished, and her stated age seems appropriate, and her face is just calm and pleasant. And so then I'll do her vital signs. So I would test her blood pressure, heart rate, respirations, and temperature. That would assess her pain level, and her pain level now at a 0. And then I would calculate the BMI for this patient. And so the patient is 5'7", weighs 138, and so the BMI would be about 21.6. And so next I'm going to inspect and palpate your head. And so the head is normal cephalic, and the scalp has no lesions or abnormalities. Hair is intact, and it is shiny in a blonde color. And then next I'm going to palpate the sinuses of the face. And so we're going to do frontal. Any tenderness?
No.
Then maxillary?
No.
Any tenderness here?
No.
All right, next we're going to check for the lymph nodes. So we're going to do preauricle, postauricle, occipital,
Tickles.
submandibular, submental. And we're going to go down the cervical chain into the supraclavicular. So any tenderness with any of those?
No.
All right, and so I would note that no tenderness with the lymph nodes, and they were discrete and that they were able to move freely. And so next I'm going to inspect for TMJ. So if I can open your mouth for me, please. And close. All right, so jaw opens and closes very smoothly, no TMJ noted. Next we're going to inspect your eyes. And so first, eyes bilaterally equal. We're going to check the conjunctiva. All right, it's pink and moist. And next we're going to check for perla. And so we're going to do pupils are round and equal. And this is going to be my pen light today. And so, excuse me, we're going to expect for reaction to light. So we're going to do a sweeping motion. And sweep in. All right, and so pupils reacted equally. And next we're going to do accommodation. So stare at the pen. All right, and, pupils accommodated with staring at the pen. And then next we're going to do the cardinal 6. So watch my fingers, please. All right, and so everything about our eyes are intact and working very well. So that would mean that cranial nerve 6, 3, 4, and 6 are intact. And next we're going to move on to your ears. And so I'm going to just palpate the pinna and the trachea. That's not trachea. That's not the trachea. The cartilage is right here. I can't think of the word, but it's okay. The cartilage are here. Everything feels normal. And then next we're going to look in the ear canal. And so this is going to now change to be my otoscope. So I'm going to hold it with my left hand and put my pinky on her cheek so she knows where I am. Pull her ear up and back. I'm going to look inside. And so her ear canal is going to be pink and looks very nice. And then her tympanic membrane is going to be a pearly gray color. Next we're going to do that to the other side. And so once again we're going to palpate. And then we're going to hold our otoscope, pinky to her cheek, pull up and back, and go inside. And again, it is a pink ear canal with a pearly gray tympanic membrane intact. All right, and next we're going to inspect the nose. So her nose is midline to her face. And also what I forgot to mention was her ears. The tip of her ears is equal to the ends of her eyes, and they are symmetric on each side. And with the nose, and so we're going to check for patency. It is a midline to her face, so breathe in. Other side, great. And so patency is symmetric and equal on both sides. Now we're going to look inside your nose with my pen lighting it. All right, and we're going to note that the septum is intact and it is hard. No lesions or erosions inside the nose. And then next we're going to check your mouth. And so the mouth, please smile for me. All right, open your mouth. And so teeth are nice and white, and every tooth is accounted for. Next, we're going to check the gums. Look pink and healthy. Can I see your tongue, please? Tongue is pink and healthy. And then check the pen light. Buccal mucus is pink and moist. And so open your mouth and say ah. All right, when she says ah, her uvula rises. And I can also tell this patient has no tonsils, so I would note that. And the pharynx, so I would also note that as well. And I would not do a gag test on this patient. I do not want her to gag or throw up on me. And then next, we're going to check the range of motion for your neck. And so can I get you ear to cheek? Other ear to your cheek? Ear to shoulder, not ear to cheek. Your cheek and your ear are beside each other. Ear to shoulder, all right. And then flexion, extend, all right. And then we're going to check with and without resistance. And so push against my hand. Wonderful. All right, and so full range of motion for the neck with and without resistance. All right, next I'm going to palpate and inspect the shoulders. And so shoulders appear to be equal and symmetric. I'm going to move on down to the arms. Move on down to the arms, and the elbows appear to be equal and symmetric. And down to the wrists. And the wrists are equal and symmetric. And we'll check the radial pulse. Pulse is bilateral equal 2+. And I'm going to check the hands and the fingers. Fingers are symmetric. We're going to check for turgor. All right, and the skin bounces back, automatically goes right back into place. And we're going to check for the capillary refill. All right, and it refills after under 2 seconds. And so next we're going to check your range of motion for your shoulders. And so can I have you adduct the shoulders? Abduct. And then we're going to do pull them up, and then behind you, and then circumduct them. Perfect. And then next we're going to come down to your hands and your wrists. And so for your wrists, I want you to invert and expert. All right, then I'm going to circumduct them, and then come down and up. And then we're going to check with them without resistance. And so we're going to push against my fingers, pull against them, and then grip them tight. All right. And so I'll say full range of motion for the shoulders and full range of motion for the wrists, and that'll be with and without resistance. And so next we're going to go right back up the arms, back to the neck, because I forgot to do palpate the jugular and the carotid. And so we're going to inspect the jugular here on each side. And then the carotid, we're going to palpate. We're going to do one at a time. I do not want to make my patient pass out. All right, and next we're going to check for the heart sounds. And so the 5 placements of the heart, we're going to start at, so we're going to start at the aortic. And then we're going to start, I'm going to go underneath your name tag, sorry. Pulmonic, Erb's point, tricuspid, and the mitral. And the mitral is where, if you want to get an accurate heart rate, you listen for 60 seconds. And then for everything, for the 5 things I'm listening for at each placement of the heart is S1 and S2, S1 separately, S2 separately. We're going to listen for the rate and the rhythm, and then for any heart murmurs or extra heart sounds. All right, next we're going to check for the lung placements. And so I'm listening for the 10 on the front, and so normally I would ask the patient to breathe in and out for every lung placement to get an accurate hearing. So I'm going to start at 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now on to the left side, we're going to listen laterally. So we're only listening to the 2 placements on the left, 1, 2, and on the right, 1, 2, 3. Want to make sure we listen to that middle lobe on the right side. You turn around for me to the back. And so we're going to find her C7 right here. And we'll start 1, 2, 3, 4, 5, 6, 7, 8, 13, 14, 15, 16, 15, 16, 17, 18. All right, turn back around for me, please. All right, and when I was assessing the arms, I would like to note that the skin, there's no lesions or abnormalities on the skin part of the arms, and the skin is warm to touch and it is dry. So you can lay on your abdomen for me, please. On your stomach, so I can assess your abdomen, please. All right. And so we're going to pull up her shirt, and so we're going to check for the bowel sounds in all 4 quadrants. And so starting in first quadrant, 2, 3, 4. All right, now I would note active bowel sounds in every quadrant. And I would note that the stomach is flat for the contour of the stomach. And next I'm going to palpate the stomach. And first I'm going to do lightly. Any tenderness? And I'm going to go a little bit deeper. Any tenderness with this one? All right, and next I'm going to inspect for the aortic pulse. Now I do see a pulsation going throughout the stomach. All right, and then while I'm here, I'm just going to assess the skin on the stomach, that it is appropriate for ethnicity, that's going throughout the skin. It is warm to touch and dry, and there's no lesions or abnormalities. All right, and if I can get you to turn around again real fast. And so while doing the lung placements on the back, I would also do the chest expansion. So I'm going to place both hands, my thumbs equally on each side of her spine. Take a deep breath in for me. And so my thumbs, when she inhaled, they expanded equally. And so turn back around for me, please. Thank you. And next, I'm going to palpate, inspect and palpate her legs. And so just feeling down, and knees are symmetric, and feeling down through her calves. I'm going to note that there's no edema, and checking just the skin on her legs. She appears well groomed throughout her legs, no hair noted. And checking her ankles are symmetric, heels are hard and not boggy, and toes and everything are symmetric. And because her toes are painted, to check for capillary refill, we're going to go to the side of her toe. So press in, and it refills in less than 2 seconds, so that is very nice. And so next, I'm going to check dorsalis pedis pulse. And I got each pulse bilaterally equal with a 2+ rate. And then each pulse here as well, a 2+. And next we're going to check the range of motion for the ankles. So being invert, and invert each ankle, and expert, all right, and circumduct them. All right, and now we're going to dorsal flexion. So pull your ankles up, and plantar flexion. Now we're going to check with resistance. So dorsal flexion against my hands, and then plantar flexion. And so ankles are full range of motion with them without resistance. And next, I'm going to ask you to stand up for me, please. And so bend each knee. All right, and so knees have full range of motion. Now I'm going to ask you to walk to the wall for me, please, and walk back towards me. And so you can sit back down as well. Patient's gait is smooth and steady. And so next, I'm going to check for your neural function. So if you can go like this on your thighs. Great. And touch each finger to your thumb. Wonderful. And last thing, I'll have you stand up and turn around. I'm going to inspect your spine. So bend over. I'm going to lift up your shirt. All right, we're going to inspect the spine, and we're looking for also inspecting the skin as well. There's no lesions, abnormalities. Skin is warm and dry and appropriate for ethnicity going throughout. And we're checking though excessive curvation in the skin and the spine, and so no expected scoliosis. And so skin overall for head to toe is warm and dry with no lesions, abnormalities, nothing to be noted out of the normal. And so this patient is very healthy, and thank you so much.